Welcome to a guide to universal precautions, standard precautions, and hand hygiene. The Department of Labor's Occupational Safety and Health Administration defines universal precautions as an approach to infection control that treats all human blood as if it were known to be infectious for some blood-borne pathogens. Blood-borne pathogens are infectious microorganisms in human blood that can cause disease in humans. These pathogens include, but are not limited to, HIV and hepatitis. A blood-borne pathogen is most commonly transmitted from one person to another through an open wound. In 1996, the CDC updated the concept of universal precautions to include contact with all body fluids, except sweat, regardless of whether blood is present or not. This set of infection control practices was subsequently renamed standard precautions. Standard precautions are vitally important because they provide a guide to basic infection control while taking care of patients. The first step of practicing effective infection control is simply washing your hands. Infectious diseases can easily be spread from one person to another by contaminated hands. Simply washing your hands properly can help prevent the spread of bacteria and viruses such as influenza. Which means that practicing good hand hygiene is one of the best ways to protect patients and yourself. It's considered the single most important strategy to prevent healthcare-associated infections, improve patient outcomes, and lower morbidity, mortality, and hospital costs. Upstate's infection preventionists ensure that everyone in the hospital is practicing good hand hygiene. It's one of their top program goals. Why is it one of their top program goals? Simply because good hand hygiene helps to eliminate or significantly reduce the number of pathogenic organisms on employees' hands, preventing transmission between patients, and reducing employee exposure to infection. The information in the slide represents the 8 instances listed in Upstate's hand hygiene policy, where proper hand hygiene is essential. You may be thinking that this all sounds like common sense, but study after study has shown that most people do not do a consistent job of washing their hands appropriately. And that most of us require frequent reminders of the CDC guidelines to proper hand washing. First, wet hands with clean, running water. The water may be hot or cold. Second, apply soap and lather. Don't fidget the backs of hands in between figures. Third, scrub hands for at least 20 seconds. The time it takes to hum happy birthday twice. Fourth, rinse hands well. And fifth, dry hands with a clean towel or air dryer. So, was this the first time you've heard of the concepts of standard or universal precautions? Were you aware of the proper steps of hand washing? How important will good hand hygiene be to you to protect yourself and your patients? You feel you could do a better job properly washing your hands more consistently? Please let us know your answers to these questions by completing the corresponding survey, and thank you for watching.